Hello everyone, my name is Cindy Antania. My student ID is 221411597. So today I'm gonna present about the topic of F1 pit stop and hospital. What is the similarities and the difference between F1 pit stop and hospital? Why did the hospital learn from the F1 pit stop? What can they learn and improve from the F1 pit stop? And what does the ER staff and operating room staff communicate during the handover? So first of all, let's talk about the F1 pit stop first. What is F1 pit stop? F1 pit stop consists of skilled mechanic that will do the adjustment or repairment to the car during the race. And when the car enters the pit lane, the driver will receive a radio message that tells them to drive the car to the designated box that already placed in front of the garage of the team. And then the team will do the tasks such as lifting the car, changing the tire, and then make some adjustment with the aerodynamics to maximize the performance, and also do the repairment if there is something malfunctioning on the car. And when the car is already done check, there will be a gantry light that light up above the driver's head that indicate so the driver can continue the race. The pit stop is extremely important because every second in pit stop is crucial, of course, to the car and the race time itself. So the team must do the work precisely and effectively during the pit stop condition. Now let's check the short video that show the condition of the F1 pit stop during the race. Let's watch it together. Now you already watched the short video of F1 pit stop, so we can continue to the next topic of hospital. What is hospital? I'm sure most of you already know what is hospital about. They treat the patient, they diagnose the patient disease, also provide the medical health care, medicine, surgery, and operation option if is it necessary. And they're also taking care of the patient that stay in hospital for the medication. Hospital also serve as the place to educate and also provide knowledge about the healthcare to the student of medication. So it's important to know the basic of the hospital. In the hospital, the important thing not only lies in surgery or operation, but also in the handover of the patient from the ER department to the operating room, because some patient condition is so crucial and must be done carefully, especially during the handle time, because there will be a certain condition of the patient that must be looked. So the team between the ER staff and operation room staff must have a good coordination to handle the handover of the patient from the ER room to the operating room. Because we already watched the F1 pit stop short video, now let's take a look at the hospital short video of handover. Let's watch it now.
You put your arms up in the air. Can you lift them on your own? Great. If I hold this one up, can you hold it up? Okay. And your leg here, I'm going to hold it up. Can you keep it up in the air? And this one, can you keep it up in the air? Great. Do you feel me touch you there? Okay, you feel it over there? Okay, smile for me. Show me your teeth. Good. And look at my finger here. Look over this way. Over this way. Okay, good.
So we already watched the video of hospital handover, and we already know the general things about the F1 pit stop and the hospital. So why must we know about the hospital and F1 pit stop? Because they seems to be in the different field, so we must explore more. First of all, we will find the similarities and the difference between the F1 pit stop and the hospital. In terms of similarities, there is precision and coordination. In the pit crew, they need to change the tire, they need to replace the damaged part, and all of that requires precision and coordination. Also in hospital, they need to transfer the patient, and also they need to transfer the information completely without leaving any important information between nurse, staff, and also doctors. The next one is the teamwork. Of course, teamwork is needed in both of field because it is important to maximize the outcome of the job. And the last one is the time pressure. In both of the field, they have the time pressure, but in different of urgency. In F1 pit stop, they aim for speed, while in the hospital, they aim for the patient safety first. So it's difference in terms of urgency, but they still have the similarities in the terms of time pressure. And then we are going to talk about the difference between the hospital and the F1 pit stop. I think the difference between both of the field is obvious for everyone because one is about race and one is about the health care. So the first one I'm gonna talk is the purpose. The purpose of the F1 pit stop is to aim for the maximizing the race performance, while the hospital aim for the well-being of the patient. And also their risk target is different. The risk in the F1 pit stop is occur more on the mechanical side, while in the hospital it occurs on the human well-being. So it's both of them is important, but one is more mechanical and one is more about the human life. And the next one is the speed. The F1 pit stop crew speed in the world is extremely fast. They can do it only in a few seconds. Sometimes it takes more than a minute because the crew have some problem, but most of them happen in a very short time. While in hospital, they have a little bit slow on the slow side because the time for doing that and the process is more complicated because the every patient have different condition. And then the last one is the setting of the place. F1 pit crew work in the racetracks, while the hospital have their jobs in handover is in the intensive care units and the operating room. After knowing the similarities and the difference between the F1 pit stop and the hospital, we now move to the next topic. So, why did the hospital learn from the F1 pit stop? First of all, it's because the similarities between of them. In the F1 pit stop, they need the time pressure, they need the teamwork, they need the precision and coordination, and so do the hospital. They need the same things, but F1 pit stop crew can do their tasks very fast, and the coordination between team is really good That's why they can do their task really fast in just a few seconds. That's why the hospital aim for the same thing, and they want to learn from the F1 pit stop how to manage their time, coordination, and the teamwork between the staff and the people that include in the process of the work. We already know why the hospital learned from the F1 pit stop, mostly to aim for the precise and coordination, teamwork, and also the time pressure. And what did the hospital improve then? First of all, they made the structure approach, so they made a standardized process of handover the patient so the staff can follow the standard process. After following the standard process, of course, the process will follow the one in the standard and will not come out from the standardized procedure. That's why the handling of the patient can become more can have more coordination and precise because of the standardized operation. And the next one is to design a leader. So they must have one designated leader for oversee and observe the handover of the patient from one department to another department. Maybe they can choose the senior doctors in the hospital. And then clear communication. One of the most important things in handling the handover of the patient is the information of the patient. So between the staff, they must have clear communication about the information of the patient, mostly highlighting the injuries, the vital sign, and also the treatment plan for the patient. And then the improvement they made is to have a more centered in the patient, so they need to involve the patient if it's possible, and also maybe involve the family of the patient to know more about the patient condition, and also the documentation for the document that include the data of the patient information, they must send it clearly. And the last thing we are going to talk about in this video is about the question of what does the ER staff and the operating room staff communicate during the handover process of the patient. So the first one is, of course, the information of the patient, such as name, age, and any other relevant information. And then the medical history of the patient, the vital signs, and also the condition of the patient during the handover, of course, the injuries that they suffer, the diagnosis tests such as X-ray and CT scan, and also the treatment that already given during the previous process, and any if there's any medication, fluid, or another treatment that already have been given to the patient, and also the airway, the breathing, and the circulation of the patient, and also the consent of patient if there is any surgeries of operation needed. That's all for my presentation about the topic of F1 pit stop and hospital. Thank you for already listening to this far. And the next one will be the question from my friend Priscilia Natalie Adesta. And also I will mention the reference I use for making this topic and video. And I hope you can check that out too, because you can learn more from the reference. Thank you. This will be the question from the Priscilia Natalie Adista.
Thank you, Cindy, for your presentation. I have a question. My name is Priscilia Natalia Desta with the student number 2214121149. My question is, what the challenge my hospital phase when they adopting practice from Ferrari pit stop, and how they overcome them. Just it my question. Thank you.
Okay, thank you for the question from my friend. So, of course, there will be a challenge when adopting the procedure in the F1 pit stop to the hospital. The first one, they are handling different things. The hospital handling human lives, while the F1 pit stop handling the car. So it's different things, but what hospital can do is training their staff and also ensure to double check the patient condition to prevent any errors to occur to the patient. And the next challenge is the complexity, because the patient condition is different between one patient to the other patient. So of course there will be different treatment between the patient. So the staff must learn to adapt and having more experience to handle different types of patient condition, and also to prioritize the critical task first in handling the patient. And also the communication between the staff is also crucial, and to have more consistency they can have the standardized procedure of handover to make sure the consistency of handling the handover of the patient. That's all for my answer. This is the end of the video. Thank you for watching. Goodbye.